There we go. Okay. I'm just freed up some disk space. So the equation that you need to solve for that last patient, the amount of blood release or amount of oxygen release per 100 milliliters of whole blood, that's what we just solved in problem number 3. We're told in problem number 4 that we have to deliver 250 milliliters per minute. You solve for this patient's cardiac output. You solve for that. If you solve that his cardiac output is less than 3 liters per minute, then this patient lives because they have a cardiac output that can sustain this delivery. Remember, the max that they can afford is 3 liters per minute. If you calculate that their cardiac output required to drop off that 250 milliliters per minute is higher than 3 liters, you have a dead patient. So does your patient live or die? Again, we might get different answers to that question based on how you drew your lines for patient 3 and how you interpreted the percent saturation. Are there ever calculators used on lecture exams? No. So, do you need to worry about these kinds of problems on your final exam? Not this one. But if I give you a second y-axis like we had with the Charles example, you don't need your calculator, do you? You still had to draw your vertical lines up and your horizontal lines across, didn't you? That technique was the same. So if I give you that second y-axis, then you don't need your calculator and you should be able to interpret the graphs. Agreed? Better? Sort of? Or you're thinking, so glad I've got a week and 2 days before I need to know this stuff. Okay, I'm going off air.